D. Quervain thyroiditis. It is also known as granulomatous thyroiditis. There is granulomatous inflammation of thyroid gland in D. Quervain thyroiditis. ग्रैन्युलोमेटस इन्फ्लामेशन है तो मल्टीन्यूक्लिएट जाइंट सेल्स मिलेंगे. मल्टीन्यूक्लिएट जाइंट सेल्स आर फाउंड इन द later stage of this disease, and these multinucleated giant cell, they will surround the pools of colloid. So D. Quervain thyroiditis is also known as granulomatous thyroiditis. The clinical presentations are, first of all, pain. It is the most common cause of thyroid pain. D. Quervain thyroiditis is the most common cause of pain in the thyroid gland. Pain can be in the upper neck, jaw, throat, ear. There can be fever, fatigue, malaise, anorexia, myalgia, and enlargement of the thyroid gland. This enlargement is variable. Pathogenesis of D. Quervain thyroiditis. It is secondary to a viral infection. It is associated with virus such as Coxsackie virus, mumps, measles, and adenovirus. The patient commonly presents with a history of upper respiratory tract infection. Because of viral infection, there will be virus-induced altered host antigens. These antigen will be presented in association with HLA-B35. This will lead to the activation of cytotoxic T cells, which will damage the thyroid follicular cells. Because of the damage of thyroid follicle, the thyroid hormones will be released. Because of this release in thyroid hormones, there will be transient hypothyroidism. Transient means for 2 to 6 weeks. For 2 to 6 weeks, there will be hypothyroidism, and then there is hypothyroidism due to the loss of thyroid substance, and this lasts for around 2 to 8 weeks, and then it recovers. D. Quervain thyroiditis, it is secondary to a viral infection, and it is a self-limited condition, self-limited disease. Gross morphology: the thyroid gland may show unilateral or bilateral enlargement. The thyroid gland will be enlarged and firm. And the cut surface, the tissue will appear yellow, white, rubbery, and firm. The thyroid gland will be enlarged unilaterally or bilaterally. It will be firm. The cut surface, on the cut surface, the tissue will be yellow, white, and firm. Microscopy: the histology will be dependent on whether the disease is early or late. In early changes, there will be scattered disruption of thyroid follicles, and these follicles will be replaced by neutrophilic microabscess. Early changes include scattered disruption of the follicles replaced by neutrophilic microabscess. In the late changes, there will be aggregates of lymphocytes, histiocytes, that is activated macrophage, and plasma cells. There will be presence of multinucleated giant cells around the pools of colloid, and fibrosis may be present in the late change. Early change में the scattered follicles will be replaced by neutrophilic microabscess, and late changes में there will be aggregate of lymphocytes, histiocytes, and plasma cells. Then there will be presence of multinucleated giant cells around the pools of colloid.